Hello, my name is Robin Booth, and I am going to complete a physical exam on my volunteer patient. And this is Christy.
Hello, Christy Mybers, nurse practitioner.
And Robin Pearson Booth to do a physical head-to-toe exam on my volunteer patient. Okay, so we are going to start with examining the skin of the upper extremities. And so we're looking for any lesions, we're looking at color, we're palpating for temperature, turgor, texture. Okay, now we'll do the lower extremities, looking at color, lesions, looking at the hair distribution, checking for edema. We're palpating for any lesions or lumps. And varicosities was the other thing we were looking for. Okay, so now we're going to go to the head, and we are going to, again, look at color, symmetry, looking for any lesions on the head. We're looking at the hair distribution, and so then we're going to palpate the frontal sinuses, the maxillary sinuses. We're going to palpate the scalp, checking for any lesions or lumps. And we're going to check the hair for texture and condition. Okay, so then we're going to go to the eyes. So we will first look at them in terms of symmetry. We're looking at the eyelids, we're looking at the conjunctiva, we're looking at the sclera, we're looking at the palpebral fissures, and we are looking at lid lag. We're also looking at the lacrimal ducts, and we're palpating the lacrimal sacs. Okay, so then we're going to, if we are discussing that a Snellen test would be done for acuity, and we're discussing that the Rosenbaum test would be used for reading. So then we're going to do the 6 cardinal fields. If you will follow my finger. We're checking for extraocular movement. Okay. Now we're going to turn the light off and check for the corneal light reflex to see if it's in the same spot on both eyes, which it is. Then we'll do a test by confrontation called the cover-uncover. And again, checking to see if it's in the same place. Cover, uncover. And that concludes that test. Next, we're going to look at the retina. If you'll look over there, I'm going to keep your head down a little bit. Okay. So we're checking for the red reflex. We're looking at the optic disc for color, arterial to venous ratio, checking for any exudate, cupping, looking at the size of the vessels. Okay. Again, look over there, eyes down a little bit there. And we're looking for the same things. Okay. Alrighty. Okay, so now we're going to look in the, we're going to examine the nose. Okay, so again, we're looking for size, shape, symmetry. We're going to palpate. We're going to check and see if each passage is clear. If you'll sniff. Sniff. Okay. Now we're going to check in the nose. And so here we're looking at the membrane and we're looking at the septum and the turbinates. Okay. And next we're going to do the smell test. If you could close your eyes. This is checking for the olfactory nerve. Let me know if you can smell this.
Yep.
And tell me what it is.
Cinnamon.
Mm-hmm. Okay, keep your eyes closed.
Smells like lime.
Okay. All right. A little cinnamon on it. Now it'll smell like that. Okay, so next we're going to check the lips and mouth. And we're inspecting for color, for lesions, open. We're looking at the teeth and the gums, the buccal mucosa, okay, and the tongue. Stick your tongue out and say ah. So we're checking there for the soft palate and uvula raising equally. Say ah again. Okay. All right. Now we're going to check your tongue. Stick your tongue out and go to the right. Go to the left. All right. We're looking at, lift your tongue up. Looking at Wharton's and Stenson's ducts. Okay. All right. Now I want you to let me just check your masseter muscles there. All right. Now open and close your jaw. I'm checking for TMJ. Okay. Now clench your jaw, and there we're checking on the masseter muscles. Go, yeah, good job. Okay, alrighty. So next we're going to go to the ears. So we'll check the auricle. We're looking at the ears for any lesions. Palpating the auricle and the mastoid. Okay. All right. While I'm at it, I'm going to check the temporal pulse. That's on another section, but I'm afraid I'll miss that if I don't do it now. That's under cardiovascular. Okay. All right, so now I'm going to look in your ears. And this will be, we're checking the external meatus, and then we're looking at the ear canal, and we're examining the tympanic membrane for the cone of light, and the umbo malleus, pars tensa, and pars flaccida. And I'll do the same thing on the other side. Okay. All right. Okay, so now we're going to examine the neck. So we're again looking at the color, looking for any lesions, looking for any pulsations. We're looking to see if the trachea is in the midline, and if the thyroid appears to be, you know, the normal size, and again, midline. And we're checking for fullness in the neck. We're going to palpate the carotid arteries. Okay, and we're going to check for lymph nodes. We're checking pre-auricular, post-auricular, submandible, submental, and sublingual. And then we're going to palpate for posterior, turn your neck to posterior cervical nodes. Okay. Mid, keep your head in the middle there. Mid-clavicular, and then anterior clavicular. Cervical, not clavicular. I just like that word, clavicular. Those were posterior, mid, and anterior cervical. Supraclavicular would be in here. Okay, so then we're going to palpate the trachea, and then we're going to palpate the thyroid, borders. Okay. All right. So now we're to the chest. I'm going to pull your hand down, and you can pull your arms out. All right, so now we're examining the chest. We're looking for, again, we're looking for color, we're looking for any lesions, we're looking for any kind of the symmetry of the respirations, the shape of the chest. And we're going to do that anteriorly and posteriorly. Okay, and then we're going to auscultate breath sounds. We'll do that anteriorly. Take a deep breath. And let out. Okay, another one. Another one. Another one. Another one. posterior. Deep breath. Out. 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 So now we're going to palpate, and as I touch you, say 99.
99. 99. 99. 99.
Okay. All right, so next we'll do the percussion for the diaphragmatic excursion. And that is, so what we're looking for there is the sound would remain the same. As the diaphragm is raised on breathing. Deep breath. Okay, out. All right, so now we're doing lung expansion. So, put my fingers here, little wrinkle. Now if you'll take a deep breath. Okay. All right. So now we're going to percuss anteriorly. Okay. All right. That concludes the lungs. All right, so now we're going to move to the abdomen. No, heart, sorry. Heart. So we're going to listen. First, we're going to feel if we feel any murmurs. Then we're going to palpate for the PMI. Now we're going to listen. And that's the aortic. Tricuspid. Pulmonic. Tricuspid. Erb's point. And apical. Okay, and listening for any murmurs. All right, now we're going to check pulses. We did the temporal. We're going to do the brachial. Radial. popliteal. Dorsalis pedis. Okay. Now you can lay down. Now we'll do the abdomen. So on the abdomen, we're checking for color, skin condition, any lesions, any bulges, pulsations. Looking at the umbilicus, is there any lumps or anything around there? And so then we're going to auscultate first, listening for vowel sounds. Aortic bruit, renal. Okay. So then we percuss to establish the border of the liver. And we're going to percuss the spleen. So we would palpate for the spleen. And while I'm over here, I'm going to palpate for the kidney. Now, palpate for the liver. And the right kidney. All right, so I checked the aorta for bruit, the renal artery. I need to check the femoral artery. And I also need to check the thyroid and carotids for bruit. so now we're going to move to musculoskeletal. And if you'll sit up. Okay. All right, so first we're going to check your cervical spine. So if you will bend your chin to your chest, and then now back as far as you can go. Okay, to the right, to the left. Okay, now rotate. All right, that's good. So we're going to check the spinous cervical nerve. And so I want you to press your head against my hand. Okay, press. Okay. Now towards. All right. Okay, so now we're going to, I want you to shrug against my shoulders, my hands. Shrug your shoulders up towards, yeah. Good. All right, and now we're gonna look at the shoulder. Oh, we're gonna check all of the joints first. We did the temporomandibular. Now I'm looking at the shoulders for any nodules or anything. I'm going to palpate. Rotator cuff, acromion process, clavicle. Okay, now I'm going to go to the elbow, looking for contour, nodules, palpating. Okay, the wrist. Hands, metacarpal joints, and hips. Iliac crest, knees, ankle, and toes. Iliac crest in here. Knees, ankle, toes. Okay, so now we're going to do range of motion on the shoulder. If you'll hold your hands out straight for me. Okay, now put them behind you. Okay, now one across, now the other. Okay, now back to your scapula. And back on the other one. Now, reach back. Okay. Reach back with the other one. Okay. All right, so, that's range of motion, so now we'll do strength. So if you'll hold your arms out, oh, I'm sorry, I forgot to do abduct. I did abduct, or put your arms out like that. Okay. Now, put your arms out straight, and I'm going to try to push them down. Okay. All right. Now we're going to do elbows. So bend your elbows, okay, then go like that, okay. All right, now straighten your elbows, okay. Now hold your elbow like that, and I'm going to try to straighten it. You resist, okay. All right, so now we're going to check the wrist for range of motion, flexion, extension. Point your hands in, no, keep your hands straight, your arms straight, and point your hand, okay, and then the opposite direction, okay. All right, so now I'm going to, if you'll have your wrist like that, I'm going to try to straighten them. Okay, now put your hands out straight, and I'm going to try to bend them. Okay, now take your fingers like that, okay. Now I'm going to try to close them. Okay, now you close them, and I'm going to try to open them. Okay. Now make a fist, okay? Now take your thumb to each finger, and then to the base of the pinky, okay? To the base of the pinky, okay? All right, so now I need you to lay down. Okay, and straighten your leg out. Okay, now take this one up to your chest. All right, and then now go to the side. Okay, move it all the way over here. Okay, now straighten that one out, and that to the chest. Move over there. Now over there, okay? Now straighten them out, okay? And I'm going to try to bend it. Okay? All right, now we're checking your knee, so bend your knees, okay? Straighten your knees. All right, now I'm going to try to bend your knee while you keep it straight. Okay, and for the record, I checked elbow strength is the same as checking for shoulder strength. All right, now for your ankles, I want you to flex your feet up, okay? Point them down. Roll your feet to the center. Now to the side, okay? So now with your feet flexed up, I'm going to try to press them down, okay? All right. So now I'm going to check your spine. If you can stand up. There. And face that wall, okay? So I want you to bend waist forward. Okay, back, all back, now to the right, now to the left. I'm checking for, bilateral movement. Now touch your toes. I'm checking the spine for kyphosis. Okay, that's good. Now I want you to take 4 steps, heel, toe. Okay, now turn around and face me. I want you to close your eyes and hold out your arms. That's the Romberg test. Okay, so you can open your eyes now. All right, now you can sit back down, and we're gonna do those were 2 of the neurological signs. So now we're going to have you, close your eyes and tell me if it's soft or hard. Close your eyes.
Soft. Hard. Hard. Soft. Soft. Hard. Soft. Soft.
Okay. Now this is to check the position, the sense of position. So I want you to close your eyes. I'm gonna hold your big toe, and you tell me if it's up or down.
Down. Up. 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 Down.
Okay. All right, and tell me if you can feel this.
Yes. Yes.
And that brings me back to the Weber and Renee test for your hearing.
Yes. I feel. Yes. Yes, I'm here. I can feel it. I'm here.
All right, now we're gonna check for deep tendon reflexes.
Hate to interrupt the exam, but do you want an hour for lunch?
Checking the reflexes. And Rep, yeah, let them dangle a little bit. Do your arms like this. Dangle that one. Okay. All right, you can relax. That's a brachial. I did, oh, this one. Brachioradialis. Okay. And so we did patellar. All right, and that concludes the test. Making sure that that concludes the test.